You know, what's the most reliable, hardworking engine you own? Nope, it's not in your car. It's right here, in your chest. We're talking about the heart, this incredible muscle that just works and works, day and night. So today, let's take a journey right into the center of it and see what's really going on.
And just to put its job into perspective, think about this number. Over 100,000. That's roughly how many times your heart beats every single day. It's an absolutely mind-boggling amount of work, pushing blood to every tiny part of your body, and it never, ever gets a day off.
Okay, so before we start following the blood, let's get our bearings. A lot of people think the heart is way over on the left side, right? But it's actually tucked right in the center of your chest, in this little protected compartment called the mediastinum. It's kind of like the body's command center, perfectly placed to run the whole show.
To really get a feel for how this incredible pump works, we're going to do something cool. We're going to follow a single drop of blood on its entire trip. This journey is going to take us through all 4 chambers of the heart, and it'll show us its brilliant design for managing blood flow.
So, our journey starts right here, on the right side of the heart. This is where all the used-up blood comes back after it's delivered oxygen to your muscles and organs. In diagrams, you'll always see it colored blue. It flows into that first chamber, the right atrium, and then drops down into the right ventricle.
Now, from that right ventricle, the blood gets a big push out through the pulmonary artery. And where is it headed? To the lungs. This is the essential pit stop. It's where the blood drops off all the carbon dioxide it's carrying and gets a brand new, fresh supply of oxygen.
All right, fully re-oxygenated and now bright red in our diagram, that blood makes its way back to the heart. But this time, it enters on the left side. First, it fills up the left atrium, and then it moves down into the really powerful left ventricle.
And here it is, the grand finale of the whole circuit. The left ventricle is the strongest part of the heart, and it has to be. It's got the huge job of pumping that fresh, oxygen-rich blood into the aorta, which is basically the body's main superhighway. From there, it gets sent everywhere, from your brain all the way down to your toes. And then, the whole cycle starts over again.
So, we've seen the path the blood takes, but what about the beat itself? You know, that classic Lub-Dub sound? Well, that's the soundtrack to this beautifully coordinated mechanical dance that's happening inside your chest, second by second.
This whole sequence of events has a name, the cardiac cycle. It's just a complete process, from the start of one heartbeat all the way to the start of the next one. And it's really broken down into 2 main phases.
The first phase is called systole. The easiest way to think about it is the squeeze. This is when those 2 bottom chambers, the ventricles, contract really hard to force blood out, one side going to the lungs, the other to the rest of the body. And right after the squeeze comes diastole. This is the relax and fill phase. The ventricles relax, which allows them to fill back up with blood from the atria above them, getting all set for the next big squeeze. It's this perfect rhythm of squeeze, relax, fill that keeps everything moving. Okay, so we've got the squeeze and the fill. But what's actually making that sound? You know, the sound we all associate with a heartbeat. You might think it's the muscle contracting, but it's something else entirely. And what's so cool is that the sound isn't the muscle working at all. It's the sound of little doors or valves slamming shut. That first sound, the lub, is the sound of the mitral and tricuspid valves snapping close when the heart starts to squeeze. And the second sound, the dub, is the aortic and pulmonic valves shutting after the blood's been pushed out. It's literally the sound of doors closing, keeping blood flowing in the right direction. So every single Lub-Dub is telling a story about how well those valve doors are opening and closing. And, as you might guess, doctors have a very specific way of listening in to decode that story.
Yup, the good old stethoscope is the key. It lets a trained ear listen directly to the mechanical sounds of that cardiac cycle. They can hear the rhythm, how clear the sounds are, and they can pick up on any unusual noises that might hint at a problem.
One of the most common things they might hear is something called a heart murmur. So instead of a nice, crisp Lub-Dub, the doctor might hear a little whoosh or a swishing sound in between. And that's usually a sign of turbulent blood flow. Think of it like water flowing smoothly in a pipe versus water hitting a rock and getting all choppy. And that turbulence usually comes down to one of 2 main issues with those valve doors. A murmur could be caused by a stenotic valve. That's a door that's gotten stiff and narrow so it doesn't open all the way. Or it could be a regurgitant valve, which is basically a leaky door that doesn't close tightly, letting some blood flow backward when it shouldn't. So, we've taken a trip through the heart, we've listened to its rhythm, and we've even decoded some of its unusual sounds. All of this leads to a really important question. What happens when this amazing pump starts to struggle?
When the heart just can't keep up and isn't pumping blood as effectively as it should, the body has ways of letting you know. It starts to send out some pretty clear warning signs.
And this is why it's so important to pay attention to what your body might be telling you. Things like chest pain or palpitations, that weird feeling where you suddenly become very aware of your own heartbeat, or getting short of breath, swelling in your legs, or even fainting. These can all be signs that the heart is having a hard time doing its job.
So from that simple journey of a drop of blood to the complex story told by its sounds, the heart is constantly narrating our health. Really understanding its language is the first and most important step in taking care of it. Every single beat tells a story. Are you listening to yours?